Welcome back to the show. You know, with the latest non-invasive treatments, there's really no reason not to have perfect-looking skin. And here to tell us more, we welcome from aesthetic medicine, Dr. Jerry Darm, along with one of his patients. That's Libby Mahidi-Burkle. Nice to have you both here. Dr. Darm, let's talk about sun damage. And this is going to be a silly question, but the answer is deeper. What causes sun damage?
Well, sun damage is obviously the exposure to the sun and excess exposure without protection.
And so sunburns are what really affect your skin.
Sunburn, tans are, I have to say, tanning is bad, but sunburns are worse. And tanning beds can actually cause cancers in young people.
When somebody has a sunburn, like I had sunburns all throughout my childhood because sunscreen, we didn't even think about it. So you have sunburns early in life. When do you see the negative results of that? Well,
the results may occur, you might see the results 40 years later or 50 years later. So once the skin has been damaged, it's to some degree, it's damaged forever, and you may have to treat it forever.
And rosacea is a hereditary...
It's a hereditary disorder, but it can actually be made worse by sun exposure and overexposure.
And Libby, you were treated by Dr. Darm for both sun-damaged skin and rosacea.
Yes.
What treatment did you receive?
Initially, I went to Jerry to have the sun damage and the rosacea taken care of, and the most prominent change was with the sun damage, which was predominantly on both sides of my face, along with something akin to a pregnancy mask, discoloration. And it was amazing how the treatments were done, and in 10 days, almost to the day that Jerry said it would happen, Dr. Darm said it would happen, it all flaked off from after having the laser treatments done, and a beautiful skin.
Well, you have great skin. We're looking at pictures here before and after. How does the laser treatment work?
Well, it's an intense pulse light device with the radio frequency added, and so it helps with the, for rosacea, it helps with the flushing, it helps with the redness, with the spider veins, and for the sun damage, the little brownish spots are what are targeted, basically.
The brown spots that we call liver spots?
Liver spots.
Yeah, I know. Every time you're here, you point out where they are. I know, I got it here, I know. Well, is it painful, Libby, to have those treated?
No, not at all. It just feels like a little zap. The description you're given before the treatment is it feels like a rubber band snapping, and that's pretty much on target. A gel is placed on, and there's a cooling air that keeps the skin at a good temperature, and you don't really feel much at all.
Well, what is that laser doing to the skin? Is it taking away that skin cell? Is it reversing something?
The technical term is selective photothermolysis.
Well, that's what I thought, but explain that for our viewers in a way they can understand.
The light heats up the target, so the red vein or the brown spot, while sparing the white skin, basically. And we actually even have treatments now for darker skin as well.
It's amazing. And will that treatment last forever, or do you need to do maintenance?
You've got to do a redo every so often, because remember, once the skin's damaged, it's damaged forever. And so you've got to come back, periodically. So you might do 3 treatments initially, and then maybe once or twice a year.
I just had a treatment 2 days ago.
Really?
A touch-up treatment. Mm-hmm.
You can't tell.
Yeah, no,
can't tell at all.
No.
You said that after 10 days, the flaking goes away. So it obviously flakes some of that skin away. Is that right?
Initially, but later on, there's not as much flaking with the maintenance treatments. So.
What did your friend say to you after you had it done?
Oh, the comments were people dropped their jaws. Like when I went to work that week, it's like, what happened? And ever since, I just love having what I call peaches and cream skin, or Jerry calls peaches and cream skin. I don't ever have to wear makeup again, and that was my goal. I don't wear any kind of makeup at all, and my skin is just wonderful.
Very good. Well, folks, so if you'd like more information about reversing the damage of sun damage or rosacea, give Dr. Jerry Darm a call, 503-697-9777, and we'll have information, too, on our website at KATU.com. Thanks for coming in and sharing the story.
Thank you.
Good to see you again.